Welcome to the weekly checkup on ReachMD for the week of November 9th, 2015. This week's news segment explores a new and unsettling route of disease transmission never before witnessed: tapeworms that can transmit cancer. Scientists from the Centers for Disease Control and Prevention have uncovered the first known transfer of cancer cells from a parasite to a human. Lung tumors analyzed from a Colombian patient were 10 times smaller than typical human cancer cells, originating from a parasitic infection by the dwarf tapeworm. Unfortunately, these cancer cells proved to be just as internally destructive as human cancer cells, even fusing together in ways previously unseen. And the patient died of complications from this disease. Further investigation is underway to determine fully how and why these tumors developed. For more information on similar topics, head to ReachMD.com. ReachMD continues this month's focus on diabetes with a segment examining how improved living conditions and hygiene may be contributing to the rise of type 1 diabetes in children. Find out whether this hygiene hypothesis, when applied to type 1 diabetes, helps explain the increased onset of this disease. And now for a quick look at some of our latest featured content. Many physicians experience difficulty balancing their occupational, familial, and personal needs. Hear from one doctor's personal experience and why he believes reform could be the answer in the book club segment, Doctored: The Disillusionment of an American Physician. For more feature content, head to ReachMD.com or listen in on iHeartRadio or TuneIn. For this week's video highlight, we are examining a unique use for raw honey. Could this ancient topical treatment hold the key to treating infection? Dr. Mary Lou Shars from World Medical News reports.
Raw honey. Can this ancient topical treatment for infections be a new key against antimicrobial resistance? Researchers at Lund University in Sweden are saying it is. They've identified a unique group of 13 lactic acid bacteria found in fresh honey. The bacteria produce a number of active antimicrobial compounds that have been effective at protecting bees' health and honey against other harmful microorganisms for millions of years. When the researchers tested these lactic acid bacteria against severe wound pathogens such as MRSA, Pseudomonas and VRE, they counteracted all of them. Some early animal trials on persistent wounds have also been successful. A topical application was given to 10 horses with wounds that resisted all other treatments, yielding complete healing in every case. Say the researchers, these findings could have implications both in developing countries where raw honey is plentiful, as well as in Western countries where antimicrobial resistance is increasing at alarming rates. For ReachMD, I'm Dr. Mary Lou Shars.
For those of you in the Boston area, be sure to mark your calendars for Friday, November 13th. Omnia Education's Women's Health Annual Visit Conference is coming to the Sheraton Boston Hotel. Come visit the ReachMD booth to learn more about our available programs and maybe even join us on air. If you aren't available to make it on the 13th, you can join Omnia Education in New York. Registration for Stages in Women's Health Conference is still open. The program will be held on Saturday, December 4th and 5th at the New York Marriott Marquis. Until then, I'm Sherry Neely, as always, inviting you to be part of the knowledge.